Today we're providing a recording of our Buteyko breathing information session so that we can offer it to a larger audience. With me today are Dr. Henriette from Integrated Dental Health, who will be providing us with an explanation of how breathing affects our dental health. Hi, Henriette.
Hello.
And we also have Vashti, who's a local Buteyko breathing instructor, who will be running workshops in Katoomba beginning on the 1st of March. Hi, Vashti.
Hello.
Henriette, could I ask you to please begin with an explanation of how breathing can impact our dental health?
Yes. Hello, Helen, and hello, Vashti. Welcome, and thank you so much for joining us for this really important conversation. It is about breathing. It is about oral health, the connection between the two. So today I would like to briefly introduce the concept of the missing link between good health and good oral health. So I would invite you to ask this question: what is the secret to good health? So what do you think the secret is, the secret ingredient to balanced facial growth and to great oral health for a child in particular? The key to a child who has good focus, concentration, and attention span, and is likely to succeed at school. The secret ingredient is nasal breathing. The impact of mouth breathing, as you can see in the pictures there, it reflects everything from lip seal to the facial development to the posture. So what is the connection between optimal breathing and the teeth? And how does functional breathing, what impact does it have on the teeth? It has enormous impact, and it is often hidden, not obvious, often undiagnosed. And as a dentist, there are three things that I look for as part of a patient's airway management: lip seal, nasal breathing, and tongue position with normal swallowing patterns. In children, this affects growth development, jaw development, as well as their dental health and general health further into the adult years. In adults, this impacts more so their general well-being and sleep, as well as the specifics of their dental health. So when we have nasal breathing, correct lip seal, and correct tongue placement, we see well-developed facial patterns of growth in a child and less orthodontic needs down the track. We see great dental health, and we see a child that has the ability to focus and concentrate at school, more likely to succeed. One of the things we look at as dentists when we assess the airways is the Mallampati score, which is a reflection of the fossa, the dark space between the tongue, the tonsils, and the back of the throat. A score of 3 to 4 indicates significant risk of sleep apnea. As far as tongue position, it is very, very important that we identify abnormal swallowing patterns, like an anterior tongue thrust, for example. Lip seal, what do the lips do when they're relaxed at rest? Now, chronic mouth breathing, it causes significant dental problems in both children and adults. It causes problems with dry mouth and the associated caries risk, bad breath, problems with enlarged tonsils and adenoids, changes in pH, more acidic, an increased risk of demineralization and subsequent decay, tooth grinding, increase in harmful anaerobic bacteria, resulting in a predisposition to gingivitis and decay, narrowing of the palate due to poor tongue placement and poor lip seal, overcrowded teeth due to narrow jaws. So in our practice, and it is my philosophy in general, that mouth breathing is a multidisciplinary problem. It requires a multidisciplinary approach. And the correct approach for both children and adults is to involve a number of specialists. Often the dentists are the first to diagnose. Ear, nose, and throat assessments are equally important. Orthodontists to expand the palate to create more airway space. A breathing coach, Buteyko, oral myofunctional therapists for muscle retraining, and sometimes craniopathy. In my opinion, Buteyko is the beginning and the end of mouth breathing rehabilitation, an integral part of our integrative holistic approach. As you can see in the table there, the effects of mouth breathing on oral health are significant. Everything from swollen gums, strong gag reflex, making it very difficult to carry out dental treatment as well as brushing teeth, grinding, lip ties, tongue ties, crooked or crowded teeth, affected hearing or ringing in the ears, tongue thrusting, dry mouth, nail biting, open bite, bedwetting, as well as behavioral issues like ADHD-like symptoms, ear infections, all sorts of other issues like finger and thumb sucking, and so on. So in my opinion, it is very, very important that this problem is identified. Often a dentist will be the first person to pick it up, discuss it with the parents. And this is where it is so important that we develop a strategy for addressing it. And Vashti, I would love it if you could take over from here. Thank you.
So Vashti, would you like to explain to us why our breathing is so important to our well-being?
Thank you so much. Thank you, Dr. Henriette. I'm privileged to be able to work with a dentist that is so holistically aligned, because it's not just about looking at the teeth. It's the teeth are in the mouth, and everything that happens around the mouth and how that impacts the respiratory system. One affects the other, so it does go. I was privileged to come across the Buteyko breathing method as an adjunct to all of the other types of drug-free natural therapies that I utilise in practice. Ultimately, the way that we breathe affects how we live. And if we're not taking care of our body, looking after our body and learning to understand exactly how our body works, learning what it is that our body needs to function optimally, and learning to let go of all of the things that we can't control in our life and actually taking responsibility for the things that we can do to improve our health, it's always going to feel like health is in the too hard basket. When we know what our body needs, when we're taking good care of our body, how can we not do the very best thing and want only the best for our body? And when we do so, we're rewarded with good health. As a health and wellbeing practitioner, I've got over 25 years of experience of working in the health and wellness industry. And this word wellness gets thrown around a lot these days. Wellness is very much about, and it can be anything, a variety of things that can bring about wellness, but it's the act of practicing daily healthy habits that are going to little by little help us to attain better physical and mental outcomes. It's not necessarily about taking 100 different supplements and eating the right superfoods. It's about making small lifestyle changes. These are the things that are going to bring about the most wellness. And when we've got wellness in our life, we're inviting in vitality. In naturopathic medicine, vitality is the key of good health, because we acknowledge that within every single one of our cells, all of the cells and all of the molecules know exactly what it is that they need to do to bring about good health. Sometimes we just have to step out of the way. When we're inviting in wellness and we're taking good care of our body, we're inviting in more vitality, and that is the power and potential of all life. And is present in all living cells of the body. And when we're inviting in vitality, we're inviting in longevity as well, living longer and healthier lives. So as a naturopath, I've recently added Buteyko breathing to a list of drug-free therapies that I can utilise, because I was always taught very early on in naturopathic college that if I could help someone to move better, if I could help them to poo better, or if I could help them to sleep better, those things alone could make a really big difference in someone's life. If I'm ever presented with an opportunity to help someone do all three of those things, I know that their wellness is going to improve out of sight. And what I came to discover is that breathing and being able to breathe better and helping us to develop better breathing habits can actually help to do all of those things without necessarily complicating anyone with specialized diets or supplements. We can change the biochemistry of the body by controlling and focusing on better breathing, which is quite remarkable, I think. And so I'm very excited to be able to share a method that can easily be taught to adults and to children to improve health and well-being and longevity. So there is a saying that when you own your own breath, no one can steal your peace. And this is very much about learning to control, learning to accept what it is that we can control and letting go of the things that we can't control. And, breathing is something that we do every single day, and we don't tend to put much thought into it. It's actually something that our autonomic nervous system, it's under the control of our autonomic nervous system. It happens automatically. We're all taking around 20,000 breaths a day. But what if we're not breathing properly? How is that going to impact our health? And if we were to learn to breathe more optimally, how could that improve our overall general health and well-being? So just something to consider. It's really important that when we're wanting to understand the breath, the power of the breath and how it can assist and support us, we first need to understand the anatomy of breathing and the respiratory system. So all of us have organs inside of our body, deep within us, and we're not looking at them every day. We see symptoms when there's dysfunction, but very few of us really understand how these organs come together and the very vital and important job that they're doing every day to help to keep us upright. We get very annoyed when symptoms come about, but very few of us understand what it is that our anatomy requires to function optimally. So this will give you a little bit of insight into that. So as you can see here, this is the anatomy of the nose. So if someone was to slice open the cavity of the head, the nose is more than just the pretty thing that sits on the outside of the body that defines how we look. There's a whole lot of anatomy going on under the surface. So the cavity inside of the head, the sinus cavity, takes up about a third of the head space. And inside of the sinus cavity, it's quite convoluted. It looks like the inside of a shell almost. And as the air is coming in through the nose, there's lots of hairs inside of the nose. There's mucous membranes that are soft and sticky and wet. And this acts as a filtration system. So the hairs and the mucous membranes alone are filtering out about 75% of all of the things from the outside world that are coming into the body. So we're talking about bacteria and viruses and pollen and dust and molds and all of those sorts of things. If we're not filtering those things in through the nose, they're coming directly into the body. So if we're mouth breathing, we don't have any of that filtration going on. So this is a very important part of our immune system. It's the gatekeeper to the outside world almost. So inside of the sinus cavity, we also have that sticky membrane. We have mucus that gets produced, and things can stick to that mucus. We can sneeze or blow our nose. We can sneeze out anything that shouldn't be there. We can blow our nose. But the sinus cavity as well is slowing down the force of the air coming into the body. So the rate at which air enters the body is a rate that is about 25 centimeters a second. So if you were to hold your hand in front of your body and just push at a level of 25 centimeters per second, so you're going in, out, 25 centimeters a second, it is quite a considerable amount of force. So it is very important that the air is slowed as it's coming into the body. So this sort of shell sinus cavity that's sort of like the inside of a shell, it's convoluted and there's little nooks and crannies, and the air really softens and really slows its pace as it's coming into the body. So it's warmed as it's coming in. The outside temperature is often much, much lower than what our actual body temperature is. Our body temperature is 37 degrees. Outside of the body is often 5 degrees or 10 degrees, or sometimes minus below 0 temperatures. the body needs to warm up that air before it comes in contact with our lungs. So the nose does a really good job of that. It moistens and warms the air and prepares it to enter into the lungs. The other interesting thing that our sinus cavity does is it produces nitric oxide. So the more that the air is in contact with our sinuses, nitric oxide molecules are produced. Nitric oxide is a very important antioxidant. It's also an anti-inflammatory compound. It's an important redox molecule, and it also serves to relax the smooth muscle in the body. So the smooth muscle is all of those that are surrounding our airways, our esophagus, into our lungs, the smooth muscle, and also the muscle that's around our digestive organs. The nitric oxide is helping to relax all of those muscles so that the airways stay nice and open. So we're getting maximum amount of air in, and there's very little constriction with the nitric oxide. And the nitric oxide also acts as an oxygen diffuser. So it helps to push or to move the oxygen into tissues, particularly into the lungs, so that we can have maximum contact with the blood and get more oxygen into the tissues themselves. Without nitric oxide, we're pushing a barrel up a hill. It's a much harder job for the body to diffuse that oxygen and actually make the best use of the air coming into the body. Nitric oxide is also an antimicrobial. So it's a very important part of our immune system.
Just a quick question, Vashti.
Yep.
So you meant the nasal cavity, not the sinus cavity, right? Yes?
The nasal cavity. Yeah.
The nasal cavity, yeah. Okay, good. Thank you.
So from the nose, after the air enters into the nose, it moves down into the lungs. So in the lungs, we have two tubes that come out from the main tube, the main bronchiole. We've got two bronchioles, and then the branches get smaller and smaller from there. It then terminates in these alveoli, which look like little grapes, I suppose, but these are very, very tiny, super microscopic. And these are air sacs at the end of all of these branches. And we have capillaries, very, very tiny blood capillaries that are wrapping around the alveoli. So inside of all of the tubes of the lungs, we have that smooth muscle, and also we have mucus lining the inside of our lungs also in all those tubes. So the mucus acts as a very important part of our immune system. It still allows for things to get trapped in the mucus, and we can cough that out if we need to. But sometimes allergic responses or hypersensitivity can cause excess mucus to be produced, and the lungs can get quite blocked up, and they're not going to be functioning and allowing for optimal oxygen exchange when they're all blocked up. But effectively, the more we have dead space in our lungs. There's parts of our lungs that we don't use if we're not breathing properly. But the more oxygen that we have going right to the very ends of those tubes, right deep into the alveoli, the more contact that the body's going to have, or the blood's going to have with the oxygen exchange. So we need to get the oxygen right down into that deep tissue, those deep alveoli. The lungs also have chemoreceptors in them that measure and regulate pH and acidity. So when the body knows that it's reaching a certain level of acidity, it will actually make us breathe faster at a more rapid rate to try and get in more oxygen to alkalinize the tissues as well. So there's lots of things at play in the lungs. On the outside of the lungs, we have all of the muscles that are involved with helping us to breathe. So in between all of the ribs are intercostal muscles. These muscles need to open and close and be moving effectively to help the lungs to move as well. And I've just got a little video here that I'm hoping will play for us that just demonstrates just demonstrates this big important muscle underneath the ribs, underneath the lungs, which is the diaphragm. Big sheet of muscle, looks like an umbrella. And as the breathing is happening, inspiration and exhalation, this diaphragm is moving up and down and helping to open the rib cage and facilitating improved lung function. If the diaphragm is ineffective or impinged or not working or not moving to its full capacity, it can affect the organs underneath, which is the digestive system that travels up in through the sheet of muscle as well. We can get issues related to our digestive system. Reflux is a really common one. If someone's got an ineffective, they're not fully engaging their diaphragm while they're breathing. And they say about 75% of all cases of reflux are actually caused by this ineffective diaphragm movement. As we've seen, there are lots of muscles that are involved with helping us to breathe. So we've got this big sheet of muscle that's underneath the rib cage that's helping with inhalation and exhalation. We've got the muscles that are between the ribs that need to expand and contract in a coordinated motion. And also, you know, there are various muscles that are connected around the thoracic region, which are some of the muscles into our neck. And ideally, our neck muscles should not be assisting or supporting us to breathe. Most of the work should be done by the intercostals and the diaphragm. It's a huge bellow that's inside of the rib cage. But too often, if we're not breathing optimally, there will be an intense amount of stress and strain that is put on the neck muscles. And often we see people with poor breathing habits. Not only is their posture affected, but they're also getting lots of neck pain and tension and headaches as well. So basically, you know, yes, all of us breathe. Approximately 9% of all adults and kids have some form of sleep apnea. So what that means is that they're either stopping breathing in the middle of the night or not taking enough breaths in the middle of the night, and this is very detrimental to health. There's also a more than 40% increased risk of sleep apnea when you have a condition that causes dysfunctional breathing. So this is any kind of respiratory condition, asthma, bronchitis, allergies, rhinitis, all of those kinds of things. So 9% of all of the population has some form of sleep apnea. They're not breathing, or their body's stopping breathing in the middle of the night. And I would say that about 50% of all individuals that are in the age 40 to 50 age group, middle age group, actually have sleep apnea. So this is spread over all ages, but most people will be quite surprised to know that level of children also has sleep apnea. It's not just in individuals who are overweight and middle-aged, but it is putting them in a higher risk category. So as Henriette also pointed out to us, there are various signs of dysfunctional breathing. So when someone comes in to see me, I can observe from the way that they're holding their body, from the way that their posture is, and how they're breathing can tell me a lot about maybe some of the other health issues that they might be experiencing as well. So these are things like sighing frequently or yawning a lot. They may be randomly holding their breath in the middle of sentences, or taking small puffs of air in between sentences through an open mouth while they're talking. They could have a lot of daytime fatigue and feel like they've got poor memory or not able to remember what it is that they were doing or in the middle of doing. They may say that they feel breathless a lot or dizzy. They might have a persistent niggling cough or feel like they can't take a deep enough breath in. They're often making strange raspy noises when they're breathing in and out. There may be some whistling noises or wheezing that's coming from the chest area or just the inside of the nose as well. They'll often complain about lots of bloating and burping and digestive discomfort. They may struggle with things like pins and needles in their hands, even having things like cold hands and feet a lot of the time. They may be constantly sniffling or clearing their throat, and they definitely will not notice themselves that they snore, but they may have a partner that comments that they snore, or we might observe snoring in small children when they're sleeping. So someone isn't going to come in to see me as a naturopathic health practitioner complaining of these things, but when I'm observing it, it does give me an indication as to how the rest of their respiratory system is or isn't working, and it will help me in identifying conditions or getting me to prompt and ask other questions around that. So there are obviously some health conditions that are linked with these poor breathing habits, and these are usually quite obvious to a lot of people. Things like asthma and allergic rhinitis, sleep apnea, as we talked about, but also things like anxiety and panic attacks, which a lot of people don't realise are linked with breathing dysfunction. There can be speech disorders, poor learning and memory. So this is where we see issues with behavioural problems in young children, or learning issues at school, not being able to concentrate. Henriette, as a dentist, is going to see lots of oral health issues and crooked teeth. So this may be bacterial imbalances in the mouth. So, you know, even I see a lot of the time parents that are very vigilant about teeth brushing and very vigilant about keeping their children away from sugary snacks and treats that are constantly getting lots of oral teeth cavities for apparently unknown reasons. And it may be related to mouth breathing. These may be adults or children that are waking frequently in the middle of the night, usually to go to the bathroom, but they may be able to settle quite easily once they've woken up, but they are waking several times, or maybe just struggling to get to sleep in the first place. They can just feel chronically tired, have lots of aches and pains for no apparent reason. So multiple parts of the body aching, not necessarily just the joints, but also in the muscles as well. There can be chronic TMJ issues, so lots of tension in the jaw, along with things like bruxism and teeth grinding, which can lead to headaches as well. There can be weak pelvic floor associated, so always feeling like you need to go to the toilet, or feeling that you have a weak bladder, particularly if you're coughing or sneezing. There can be issues related to high blood pressure, and also things like enlarged adenoids, nasal polyps and tonsil issues, which we'll see a lot of in children. And while many of these conditions can be managed with medications, various medical procedures like surgeries, or devices like CPAP machines, it's not actually fixing the underlying issues or the mouth breathing habits. So while it might relieve some of the symptoms, there can be long-term flow-on effects from incorrect breathing habits. So yeah, the medication and the surgeries and the medical procedures aren't fixing those issues. So there's a saying that says that, you know, the perfect man breathes as if he does not breathe at all. So ideal breathing should be calm and relaxed and very, very quiet. So if we were sitting next to someone taking gentle breaths in and out through the nose, it wouldn't be noticeable to the person sitting next to us. We all come into the world with an inhale, and we leave this world on an exhale. What we do here with our breath can make all the difference to our quality of life. So as mentioned, healthy breathing is light breathing, it's slow breathing, and it's deep breathing with this full engagement of the diaphragm and all the respiratory muscles and all of the respiratory organs. What I have observed over many years of exploring different types of meditation and different types of breathing techniques just by default is that often the teaching around breathing is one of these three things. It's light breathing, or it's slow breathing, or it's deep breathing, but it's not often all three of these things. And unless we are retraining the breath to be a perfect balance of light, slow and deep, which is the Buteyko method, we may not be engaging the respiratory system and actually doing that full reset of healthy breathing that should happen. When we're trained the body to breathe properly, and they say that if we're really dedicated at doing this over a 90-day period, there is a reset that occurs, and the body will naturally come into healthy breathing without us needing to really focus and practice on it all of the time. But unless we're engaging breathing habits that are low, slight and deep, slow and deep, and practicing this with exercises that are focused on those things, the full reset is limited. And so I do see people frequently turning up to clinic that have been doing breathing exercises, something they've learnt online or something they've done in yoga practice, and they've been doing it for a long time, but they may not have been taught it correctly, or they may not know exactly what to do when they get home, or they might have missed a vital step, and it's not going to have its full effects. And in fact, it can be detrimental. We can go into over-breathing habits by default, which is not good for us either. So I thought we'd do a little breathing exercise. This is something that everybody can do at home, and it will give you a little bit of a taste of what we do in the Buteyko breathing classes. So I'd like everybody following along at home to sit up nice and straight in the chair. And we're going to clear our nose first. So it's really important when we're doing any breathing exercise to be able to breathe in and out through the nose with the lips sealed. This is very important. And if you need to blow your nose, please do that. Find a tissue and clear the nose out first. But this is a Buteyko method that will assist if you do have a stuffed up nose or it is very congested. We're going to do a nose clearing exercise. So yes, so I'm just going to demonstrate this. So with this nose clearing exercise, we're just going to take a normal breath in through the nose and a normal breath out through the nose. And we're just going to pinch the nose and hold. And we're going to hold as long as we possibly can. So pinching the nose and holding for as long as you possibly can, and just shaking the body side to side with the head back, shaking the body side to side, and just allowing anything that's inside of the nose to drain through the back of the nose. So just taking a normal breath in and a normal breath out, and pinching the nose and holding as long as you possibly can, and shaking the head from side to side, swaying the body from side to side, holding the head back, and just allowing whatever is in the nose to run down the back. Holding as long as you can and then releasing. And if you need to blow your nose, you can blow your nose. And doing this before any kind of breathing exercises a few times. You might need to do it 3 or 4 times until you've got a really clear nose. And then sitting up straight, nice and relaxed, shoulders back, rolling the shoulders back. We're going to do a breathing exercise that involves a few gentle breath holds. So I'd like you, if you're doing this at home, to follow along at your own pace. It may feel a little bit unusual or strange, and that's okay because it's an exercise. So it's something that we're doing only for a limited period of time. It is not how we would normally breathe. But for the purpose of the exercise, trying to follow along as best as you can. If you're extremely uncomfortable or you need to catch your breath at any point, please do so. Just release your hand from your nose, catch your breath, and return to the exercise when you feel comfortable. So sitting with your back up straight, we're going to be activating and engaging all of the muscles in the rib cage, rolling the shoulders back, so opening up the rib cage as we do this. And taking a gentle, relaxed breath, not a deep breath, a gentle, normal breath in through the nose, and a gentle, normal breath out through the nose. And we're going to pinch the nose and hold for 5, 4, 3, 2, 1, and releasing. And we're taking a normal breath in through the nose and a normal breath out through the nose, and pinching the nose and holding for a count of 5, 4, 3, 2, 1, and release. And a normal gentle breath in through the nose and a normal gentle breath out through the nose, and pinching the nose and holding for 5, 4, 3, 2, 1, and releasing. And continuing at this pace, gentle breath in through the nose and out through the nose, and pinching the nose and holding 5, 4, 3, 2, 1, and release. And continuing at this pace. And at this point, as you're doing this exercise, you may be feeling some different sensations in the mouth or in the respiratory system. And pinching the nose and holding for 5, 4, 3, 2, 1, and releasing. You may be feeling a sensation of extra saliva coming into the mouth. And pinching the nose and holding for 5, 4, 3, 2, 1, and releasing. So really taking the time to observe any sensations that come up into the throat or into the chest area. And pinching the nose and holding for 5, 4, 3, 2, 1, and release. And just coming into normal breathing pattern again now. So that was just a couple of minutes that we did of a very, very simple breath hold exercise that is changing the cadence of the breath. It's changing the rhythm of the breath. We're really slowing down the amount of breaths that are coming in and out of the body over the course of a minute. So most people are breathing every day quite rapidly at a rate of about 12 to 14 breaths a minute. If we have dysfunctional breathing, if we have laboured breathing, if we have issues around bronchitis or asthma or rhinitis or any of these issues, if we have sleep apnea, the chances of us breathing at a much higher rate, it's somewhere in the vicinity of 14 to 18 breaths a minute. And when we are slowing our breath down at this pace, when we're taking a normal breath in and a normal breath out, and we're pinching the nose and holding for 5 seconds, we're slowing the breathing rate down to about 1 inhalation and 1 exhalation every 10 seconds, which effectively is bringing us into a rate of around 6 breaths a minute. And what that's doing is it's communicating to our nervous system that it's actually a hack. It's tricking our brain and nervous system into being relaxed. We're also building up our carbon dioxide levels as we're doing this, and carbon dioxide is a natural relaxant. And this is something that I would recommend someone to do if they're feeling very, very stressed, maybe feeling a little bit panicked, or at that very beginning stage of an asthma attack coming on. The sooner that you can do this exercise, or it's also very good after someone's had some shock or some trauma, just to bring someone back into their body again and to slow the respiratory rate down, because as soon as we get into a very stressed state and into that panic, it's going to cause lots of extra constriction to our respiratory system, and it's going to close the airways off. So we're effectively opening up the airways as we do this. So hopefully everybody that was following along at home is feeling very relaxed now. And, you know, this is something that you might also like to practice, you know, maybe before you go to bed at night, just to assist in relaxation. So there is a saying that we should breathe through our mouth as often as we eat with our noses. Nobody ever eats with their nose. Nobody should eat with their nose. The nose is not designed for eating. The nose is designed for breathing. Our mouth is our emergency stop valve, I suppose you can say. It should only ever open if for some reason, you know, our nose is being blocked. But effectively, it's not doing a very good job of filtering the air. It's not moistening the air. It's not warming the air before it comes into the body. And if we're breathing constantly through our mouth, we're setting ourselves up for lots of health complications and health risks. So the more we can get into healthy breathing habits, only breathing through the nose, using the organs, our respiratory organs, the way that they're designed to be used, this is actually helping and supporting our overall health. So basically, the Buteyko breathing method is just one of many drug-free natural therapies that I utilise in assisting and supporting my clients for better health. If you have watched this presentation and you're recognising in yourself or in your children any of the signs and symptoms of dysfunctional breathing that we talked about, or any of the oral health issues that have maybe been brought up by your dentist, please come and speak to or contact us after this presentation to learn a little bit more about the breathing classes that we host. We'll be doing these face-to-face in Katoomba. We have classes for both adults and children. So kids from school age, 4.5 to 5, can begin learning breathing and healthy breathing habits, which will help them throughout their lifetime. So, you're setting your child up for a lifetime of good health, whatever they learn now.
Oh, great. Thank you so much, Vashti. That was brilliant. So we'll have this recording on our website. If you've been inspired to improve the way you breathe, please contact IDH or, connect to the link below. We hope you've learned something about yourself through the information session, because at Integrated Dental Health, we want to overcome psychological barriers. We want to empower you to make the right choices for your long-term oral health. And we'd like to work with a range of practitioners providing a multidisciplinary approach. So we hope to hear from you soon. Thanks so much. Thanks, Henriette. Thanks, Vashti.
Okay, bye.
Thank you. Bye.